So Spitalfields City Farm is based in the London Borough of Tower Hamlets. So I guess the most important thing to sort of emphasise is that we're operating in the most densely populated borough in England. Our farm has been around since 1978. We grew from a local community taking over effectively a derelict space. So as you walk through the gate, there's a kind of a long green pathway that kind of takes you down to the farm itself. So it's sort of like the big reveal. So we have large animals such as donkeys, sheep, goats, and then small animals, ducks, geese, ferrets, chickens. We're also a growing space, so probably about half of the 2-acre site is given over to the growing of vegetables. So we'll grow things like tomatoes, potatoes, spinach, and lots of herbs. So we have a lot of rosemary, thyme, sage, and also a lot of fruit trees. So we'll grow things like apples, plums. We also have a mulberry tree as well. I always sort of try and shy away of kind of calling us an urban oasis, but I guess in some ways we are. I know it's probably going to sound like a cliche, but we will meet an awful lot of children, young people who have never been outside of London and who don't have the opportunity to meet animals or to be able to kind of see, the growing spaces that we have. So at the moment we have around about 50 active volunteers. And I guess it's sort of important to emphasise that all of our volunteers are very different, and their motivations for wanting to volunteer are very different, and also their demographics. So we have volunteers who are teenagers, right up to people who are in their 70s and who have retired. But one of the groups that we work with are people who are either in recovery from drug and alcohol misuse, or sort of at risk of homelessness. And then I guess how we do that is by involving them in a regular volunteering session. So that usually would involve them coming to the farm for 1 day a week, and they would either volunteer to help us look after our animals or working with our gardeners in the garden. We'll have an awful lot of people who may be suffering from mental ill health or struggling with isolation, and I think being prescribed something that they can do that's practical and that's going to involve them meeting people and getting their hands dirty, I think is a great thing. So it feels to me that what's important about a city farm is that they are very much rooted within a community. The farm is a community space.
That's Philip Nichols, CEO of Spitalfields City Farm in London. Cities and towns across the world are in need of spaces like Spitalfields City Farm, an urban oasis, as Philip puts it, that's improving their community's physical and mental well-being. In many countries, loneliness has become a serious health issue, and it's no longer just people in old age who are suffering. In fact, younger people are now more likely to be lonely than their grandparents. Academics point to a modern world that values productivity over community, a world in which more and more people are living alone or in precarious accommodation, and a world where shallow connections are much more common than meaningful ones, not to mention the effect of the pandemic. In 2018, the UK appointed a loneliness minister, with Japan following suit 3 years later. The city of Barcelona has developed its own loneliness strategy, and health professionals are now looking beyond what can be done by the traditional medical world and have started experimenting with social prescribing, where patients are referred to community support, be it a community garden or an art class. Although there's more research to be done, it's clear that loneliness is something we need to start taking more seriously. On this episode of Common Ground, we're in the UK and Australia, looking to see how the spaces we create can help cultivate connection and stop isolation. From public space designed with connection in mind, to repurposing existing structures for the benefit of the community, and simply encouraging a population to talk. Stay with us. This is a podcast by TOPOSOPHY. For more than a decade, TOPOSOPHY has been inspiring and informing its clients on how to transform places, whether they're neighbourhoods, cities, regions, or whole countries. The TOPOSOPHY team works with international organisations, multinational brands, and government agencies around the world, leading them every step of the way to find placemaking and marketing solutions that are built to last. As constantly curious people, the team loves to collect game-changing ideas that are transforming other sectors and draw valuable lessons for the future of places. This podcast series, curated by the TOPOSOPHY team, is just one example of how these valuable ideas are brought to life.
The key thing that we've been trying to do is trying to move this on from an idea that loneliness is this kind of sad thing, but it's a thing that people sing songs about. It's not really something that we deliberately try to take action on, to being something that is actually a serious issue.
That's Robin Hewings. He's director of the Campaign to End Loneliness, a British charity set up in 2011 to unite experts in the field, do research, and ultimately combat the causes of loneliness. Of course, loneliness isn't a new phenomenon, but studying it kind of is.
We think that around 5% of people were lonely before the pandemic, in that kind of chronic way, that kind of I always feel lonely kind of way. And I think that if you'd asked me around that kind of time, did I think things were going to get better? I probably would have guessed that they generally kind of would kind of go back to normal. It might take a little while, but they would go back to normal. But we've actually found that they haven't really gone back to normal. And so we think that there are around about 1 million more people who are chronically lonely than they were before the pandemic.
Let's start by getting one thing clear. Gathering hard data for loneliness isn't easy. Firstly, it's completely subjective. People tend to avoid talking about it, and there's no magic equation to measure it. But as investment in research and our ability to survey people's experience grows, governments around the world are starting to think about loneliness as a public health priority. In the UK, there are fears that loneliness could reach epidemic proportions by the end of the decade, which is part of the reason why in 2018, the country appointed its first ever loneliness minister. The government developed an ambitious strategy, including some 50 commitments, with one of its main goals being to ensure that loneliness is taken into account more in policymaking. Here's the bottom line. An increasing number of studies have shown that loneliness, or chronic loneliness as Robin puts it, is a factor for a number of medical and mental health conditions. It's been associated with a higher risk of heart disease, diabetes, cancer, and more. One staggering figure from 2021 says it can raise a person's risk of death by 45%. That's more than air pollution, obesity, or alcohol abuse. So how does the link actually work?
So the first kind of impact is often on our psychology. So when we feel lonely, the world feels like a more threatening place because we feel like we're social animals and we're kind of out of the group, and that can cause people to withdraw. And the next kind of level of effect is that those types of feelings are quite closely related to depression and social anxiety. So loneliness is both a cause of depression and social anxiety and can be a result of it as well. And then the next level of effects on the individual can be on our physical health because it's harder to do healthy things. The kind of stress of that has impacts on our sleep, and on a kind of cellular hormonal level, the long-term effects of that kind of stress, that kind of cortisol, can have effects on our cells such that we kind of age more quickly. And it has impacts on cardiovascular disease, on dementia. And then kind of going out from there, being lonely can have real impacts on our working lives. It makes people less likely to stay in work. It can create kind of absenteeism. And then the final societal level point, I think, is also very much true, that loneliness can kind of cause us to be more suspicious of people around us, and more kind of extremist groups can often kind of pick up on people who might be lonely and give them an identity through different types of extremism. The reason why loneliness has these serious health effects is very often because loneliness is at the root of why we find it difficult to do the often boring or challenging things that we need to do to look after our health. And also is that the things that you do about loneliness are very often some of the most enjoyable and meaningful things that we do in our lives. So yeah, kind of working on loneliness is a serious topic, but dealt with in often really nice ways.
I'm Barry Golding. I live in Australia. I'm a professor, retired for 8 years. I'm also a patron of the Australian Men's Shed Association, which is the national body here in Australia.
One of the ways to treat loneliness is to offer more of its antidote, connection. Since the 90s, men's sheds have been doing just that. Founded in Australia, men's sheds are volunteer-run local organisations that provide a space for all things DIY and social interaction. The movement has proven so successful that they've been officially recognised as a health service by the Australian government. This involves $1 million in grants that go towards maintaining the 1,200 plus men's sheds in the country. It's a way for the sheds to maintain their autonomy while being helped financially. And they aren't just in Australia. You can find similar setups in other countries too, the UK, Canada, Denmark and Ireland to name a few.
Basically, it's just a workshop. I guess you'd call it a workshop. Here in Australia, it's typically what we call a tin shed. So it's got a corrugated iron roof, probably, and it's got a workspace. Often there's tools for making things out of wood. Importantly, somewhere in the corner or out to the side, there's a place for making a cup of tea and a cup of coffee.
You might think it's a bit of a cliche for older blokes to retreat to these kind of spaces for alone time, but men's sheds offer the opposite of private introspection. They offer an open community space where men can work together and learn new skills from one another.
The movement started as a response to what I call men beyond paid work. And when I say men beyond paid work, I mean men who are older than paid work, or men who aren't in paid work, men who'd been involved in the military and who were suffering from post-traumatic syndrome. Some of it was about unemployment, but here in Australia, it's mainly been older men.
While all of us could use a safe space or shed, studies show that men are less likely to seek out help when they need it. In Australia, where men are 3 times more likely to commit suicide, the government outlined a national men's health strategy, which, among other things, acknowledges the way that gender influences health. Age is also a factor in the loneliness equation. While on the one hand, new studies point to record numbers of people between the ages of 16 and 29 feeling lonely, aging can often bring about additional emotional strains like relationship breakdowns, early retirement from a job, or physical health problems. Barry had long been a researcher of this later stage of life. His interest in the men's sheds movement began when he started seeing its potential among the people he studied and worked with.
It was about people's identity. It was about self-esteem. It was about people caring for each other. It was about people looking after the community. It was all these things mixed together, basically based around a community development model where the men were empowered, not as in the way we often think about clients and customers and students and patients. All those terms tend, in my view, to patronise and often infantilise men.
By focusing on empowerment, being of service and spontaneous interactions, the men's sheds remove stigma. It also removes the pressure. For those men that find it difficult to talk about things like mental health in a face-to-face environment, the sheds offer shoulder-to-shoulder conversation, helping them open up while keeping busy with their hands.
that it created an all-male environment that was non-confrontational but was also welcoming. The other thing about it, it was basically a democratic grassroots organisation where a lifetime of knowledge and skills was appreciated. The men's shed model appeals to older men also because it values the wisdom inherent in ageing. It basically says you can come to the shed whether you can cut a piece of wood or not. All you need to do to come to the shed is to be able to sit in a chair and drink a cup of coffee, or even just wield a broom and sweep the floor. If you want to do crosswords, if you want to play bocce, if you want to play cards, if you want to just sit in the corner and have a yarn, have a chat, that's okay.
The organisation has been especially successful in Australia, as they've captured a demographic that healthcare services find traditionally hard to reach. That's older men in rural towns that are not only more reluctant to seek help, but are often living far from larger cities where help is actually easier to find. But the truth is, loneliness can affect anyone, anywhere. Although rural settings have their shortcomings, there's also evidence that says rapid urbanisation can make people more isolated, with issues like overcrowding and a lack of access to nature all playing a part. Loneliness is, after all, about relationships. Here's Robin again.
Loneliness varies from one place to another in ways that can't be explained just by the kind of demographics of the people who are living there. So we did some work about loneliness in London, and people in their first year in London are a lot more likely to be lonely than people who've lived here for a long time, because it's a big transition. It can take a longer time to get used to living in a big city like London. But I think my reflection would be that they both have their pros and cons. So in cities and towns, it can be kind of easier to find people with the same interests as you, particularly people from different types of kind of minority groups, are more likely to be able to find their people in cities than they would in the deepest countryside. And so, yeah, I'd be reluctant to say that one is better than the other. What it's about doing is about trying to kind of make the most of what you have in those particular places.
So what does Robin mean by making the most of what you have in places? And how can the potential of our towns and cities be maximised to combat or even end loneliness?
You can often think of some places or some aspects of where you live that are really kind of encouraging connection. And you can probably also think about some places where you live which are absolutely discouraging connection. They are noisy or scary or intimidating, or there's nothing to do there. And so loneliness is more common in some types of places than others, again, kind of adjusted for its population. And that kind of very much, to a striking extent, actually includes green spaces and trees.
The restorative effects that nature can have on our well-being are widely accepted by now. A recent study found that when people were able to see trees or the sky or hear birds, feelings of loneliness fell by almost 30%. But it's not just nature. There are all sorts of ways our built environment has been proven to impact our mental health. For instance, something as simple as being within a closer distance to amenities will make us feel less isolated. In a recent paper, the Campaign to End Loneliness details how our built environment can affect the problem and gives a framework to tackle it.
If we want to make a difference right across the kind of whole population, then we'll very often need interventions that reach the whole population rather than only trying to tackle loneliness kind of curatively, as it were. So through psychological interventions or kind of different types of kind of individual or group services, that we really do need to have a kind of whole population preventative approach to go alongside that kind of curative aspect as well. Where I live, there's a kind of quite small park, just a couple of streets from me, and it's next to my children's school, and has been really well developed to have good things for children, good things for kind of slightly older children, as well as having some great places just to kind of sit and relax yourself. And what's great about it is that you can kind of go there on a Sunday morning when the children kept you up all night, you feel completely knackered, there'll be some people there and your children will be able to play with them and there'll be someone to chat to yourself. And it's just a brilliant example of a bit of the built environment really helping people to connect, to cheer themselves up in a way that feels very low risk.
While some environments, like the park Robin just mentioned, have organically continued to serve communities over time, many such spaces have fallen into disrepair or been entirely squeezed and priced out as our cities and towns grow. Now, city planners are having to rethink how to reallocate space for the public.
So, for example, Barcelona, which has a kind of loneliness strategy, and they're putting real work into absolutely that kind of thing about creating neighbourhoods where there's places for people to interact, where there's far fewer cars, and kind of returning kind of streets to people rather than kind of private transportation.
Barcelona wants to restructure the city by transforming and recovering public space, making the city more accessible to facilitate connection and promote different types of home sharing. And beyond large-scale restructuring, there are also simple design details that can encourage connection.
There was an organisation called the Loneliness Lab that worked particularly with the Elephant and Castle in South London, where there was massive change happening there. And what they were trying to do was both look at some of the kind of design details of how you might design new places so that you might have kind of front doors that are kind of paired so that people are more likely to bump into each other in that way, using kind of common areas and kind of entrances in ways that, again, encourage light touch connection.
Ideas to encourage light connections have sprung up across Europe. In the Netherlands, for example, the supermarket Jumbo is experimenting with chat checkouts. Instead of the ubiquitous self-checkout machines, customers who aren't in a rush can opt for the slower chat checkout. Cashiers at those checkouts go beyond the simple "Hi, how are you?" and offer a longer, friendlier conversation. It may sound absurd that we're returning to simple things like bumping into one another or having actual people to talk to at the checkout. And all this may have seemed pretty much a given a while ago, but at some point it was designed out of our modern lives. The truth is, in many cities, our rush towards efficiency and convenience has been prioritised over small yet very significant aspects of what makes our day-to-day actually enjoyable. Now planners and designers are having to take a step back and rethink how they can nudge people back into habits, such as the occasional chit-chat. Social infrastructure, spaces such as libraries and sports centres, pubs and cafes, have traditionally been important hubs for interactions within a community. But following a decade of austerity in the UK, many such facilities have been steadily declining. Almost a fifth of all libraries have been shut down, while youth centres have seen a 70% cut in public spending in the past decade. And even privately run spaces like pubs are feeling the pinch, with the cost of living crisis leading to 150 pubs closing in the first 3 months of 2023. One idea that might help keep these vital spaces going is multi-purpose buildings.
Pubs, for example, are in kind of most villages, but they're often kind of facing various kind of challenges to stay open. And one of the best ways for them to do that is to kind of move on from a model of being a place where people drink beer, but to be a place where people might shop, might pick up the post, might do banking, might go for tea and coffee. It might not even really feel or look like a pub, but what they're doing really well is kind of evolving what they do to be much more inclusive of people. And when you can kind of take advantage of the kind of assets that you already have in a place, and make them as inclusive and wide-ranging as possible, that's likely to be the best thing that you can do for loneliness in a particular place.
There are plenty of interventions, initiatives and strategies that cities, towns and villages can back, but what's important is that they reflect the specific needs of a community. While the men's sheds movement really took off in the rural communities of Australia, Barry notes how it's been adopted and adapted by the shedders themselves in each new country it's expanded to.
It's a model that's very amenable to change and it's very amenable to adaptation. And As you probably know, there's now sheds which are operating very successfully in Denmark. There's been sheds in Iceland which are operating under the auspices of the Icelandic Red Cross. There's sheds in British Columbia, in Canada, which are operating through a non-government organisation which is identified as sheds as a way of reaching a new demographic. So different countries can take up the model, but in the end they'll have to adapt it for their own uses.
Part of the reason the men's shed movement has been going for so long is exactly due to this adaptability that Barry's talking about. It sets out a flexible model that can be replicated and tweaked to the specific needs of a community, and importantly, at a very low cost.
If you were to address men's needs on a client basis professionally, you would combat isolation and men's health issues and dementia and depression and suicidal ideation through clinical work. And it's not that men's sheds replace all of that work. It probably costs the government about $2 million a year in Australia to run the Australian Men's Shed Association. That's for over 1,000 sheds. So if you do your maths, it means that basically each shed is costing the government, the national government, about $2,000 a year. That's peanuts compared to what you pay for a psychologist to do 10 sessions, one person. And the important thing is that a lot of these sheds operating in places where it will be impossible to put professional people.
But Barry emphasises that there are lots of occasions where men's sheds shouldn't replace professional help, particularly when dealing with more complex mental health issues. He also stresses that they shouldn't become professional help either. The whole idea of the shed thrives on it being volunteer and community created.
If men's sheds were to be integrated into a government health program, it would be the kiss of death, because it would institutionalise the whole thing. You'd end up with key performance indicators. You'd end up with people doing cost-benefit analyses, which were expensive. You'd have people bidding for funding. You'd be creating a monster.
What men's sheds do is make up for the things where professional and clinical help may be lacking. National health strategies can learn a lot from grassroots and community initiatives, especially when it comes to community outreach. They can work together while providing different but complementary services, be it through granting these associations some financial support, social prescribing, or offering an unused building for shedders to meet.
And there's a shed in Tasmania here in Australia. One day a week, it's a men's shed. Another day a week, it's a women's shed. On another day a week, it's a coffin club. On that day, members of the community come in to make caskets for their loved ones, and they lead to conversations about death and dying and ageing, which are quite remarkable. So here you've got a town which has got a men's shed, a women's shed, and a casket club doing inspirational work for men, women, and people who are terminally ill. And they're using the same space. Why not? In a town of 2,000 people, you might have a showgrounds where there's an annual show each year. It might have an apple festival each year. It might have a potato festival. It might have a racetrack which is only open 5 days a year. And what's happened in a lot of places is local councils have said, yeah, you can have this facility when we're not using it. Some people say, what does this do for the men? It does heaps of stuff for the men, but I've often said if it did nothing for the men, it does heaps for the community. The work they do is fixing the playground in the town square. It's building cupboards for the childcare centre. It's putting a disability ramp in. It's fixing old age pensioners' taps. Some sheds actually operate incredible recycling programs. All of these things are giving back to the community. In the last 10 years, the biggest single finding in health science is that we've come to realise that isolation is deadly and it's very unhealthy. And what men sheds do is they combat isolation.
This is a very clearly well-evidenced, very widely acknowledged determinant of physical health. So when we're doing things about loneliness, it's not a kind of nice to have, it's a core way in which we'll make sure that we are kind of mentally and physically healthy going into the future, and a way in which we make sure that we have a sustainable health care system and economy.
One of the biggest challenges the farm faces is its kind of crumbling infrastructure. And I think that, if councils are serious about city farms and spaces like city farms, then I think there has to be a kind of a realisation on their part that they might need to be able to contribute to thinking about sort of things like about infrastructure and how they can support that.
Thanks for listening to this episode of Common Ground. Before we leave, here's what we can take forward from what we've just heard. Firstly, it's important to think about accessibility when designing public spaces. As we've heard, details can go a long way when it comes to enhancing social inclusion. Incorporating features like ramps, tactile paving and seating areas are just some examples. Multifunctional spaces are also a fantastic way to make sure social interaction happens while making the most of the structures we already have. They can provide a vibrant atmosphere and encourage things like cultural events, workshops, and other recreational activities. Like everything in planning, collaboration is key. Bringing the public and private sector together can make sure the developments to a city or town turn out stronger, longer lasting, and more meaningful. There's a place for big city strategies, but officials can also learn from and partner with grassroots organisations. And when talking about mental health, involving residents in the process is especially key in removing stigma and empowering the community. Technology is also a great tool to bridge geographical distances and facilitate social connections. Providing free Wi-Fi in public spaces can encourage people to come to the area and create online platforms that spark community engagement. Finally, gathering regular data and carrying out surveys in diverse areas of a community can be a great tool in helping cities understand what initiatives and ideas can help their community, allowing them to be more responsive when adopting policies to help the loneliest in our cities. Next time on Common Ground?
There's a kind of wider sense of art as a contributor to the economy, but then there's also the thing that is kind of more important, which is where it's a factor in people's everyday lives. And in my thinking, that's where it features as the lifeblood of a city.
We're in the US and the UK looking at how culture can be a catalyst for urban renewal. This podcast was developed, researched and produced by the experts at TOPOSOPHY and the Greek Podcast Project, with production assistance from Gaia Lutz.